The Swiss Red Cross is an active member of the International Federation of Red Cross and Red Crescent Societies, IFRC, the world's largest humanitarian network, whose fundamental goal is to save lives and change minds. The Swiss Red Cross, or SRC in short, pursues this goal in Switzerland and internationally. This video provides a quick overview of the Strategy 2020 for its international cooperation activities. The International Cooperation Strategy takes account of the global and local contexts and makes due reference to the IFRC Strategy 2020 and the overall SRC Strategy 2020. The strategy focuses on specific themes and selected countries or regions. But before we look at our thematic and geographic focus, let's look at the working principles that guide us every day to ensure that we do the work right. First, we focus our attention on particularly vulnerable and deprived groups of people, and we empower them to take their lives into their own hands. In our work, we make sure that men and women enjoy equal rights, and we consider voluntary work an invaluable asset for the community. At every step of our work, we pay attention to the impact of our action, so that our projects make sense to the people and the context. We consider sound cooperation with and respect for our partners a key ingredient for our success, and we foster alliances with a variety of actors, creating networks for a positive change in the world. We take into account that our interventions influence established socio-economic relations and that we need to mitigate this potential cause of conflict. With these principles in mind, we design development programs that foster healthy living conditions and improve disaster management capacities among particularly vulnerable people and communities. In practice, this means that deprived people and communities receive appropriate support to meet emergency needs, have the capacity to prepare for and respond to disasters appropriately, and are in a position to adapt to climate change, have access to good quality health care, are able to demand their right to health and to have an impact on healthy living conditions. To reach these objectives, the SRC focuses its intervention on two spheres of activity: disasters and health. The SRC understands disaster management as a cyclical process, integrating response, recovery, prevention, and preparedness. After disaster strikes, we launch emergency relief operations that ensure the survival and alleviate the suffering of affected people and communities. The emergency phase gradually gives way to rehabilitation and reconstruction, supporting the affected communities on their way back to normality. Here we focus our intervention on improving the living conditions of the concerned communities, making sure that destroyed and damaged houses are restored, that communities have access to drinking water, that they can use appropriate sanitation facilities, and that they adhere to good hygiene practices. To act against future loss of lives and livelihoods, we work with the communities and partner organizations and develop strategies and actions to prevent and reduce the risk of new disasters. But our work goes beyond disaster alleviation. We want to enable people to fulfill their dreams. Health plays an important part in this endeavour. We understand health as the state of comprehensive physical, mental and social well-being. Living a healthy life is a human right and key to social and economic development. Our aim is to provide access to health to all disadvantaged people by bridging the gap between the health providers, such as the health posts or medical centres, and the individuals and communities who are seeking health services. To achieve this, we raise people's awareness on how to lead a healthy life on the one hand, and we contribute to improved access to basic health services on the other. Mothers, children, as well as elderly and handicapped people are especially vulnerable and deserve our particular attention. Furthermore, our work mitigates the risk of diseases for the population by addressing certain factors that have a direct effect on people's health condition. These are, for example, clean water, proper sanitation facilities and hygiene, as well as well-balanced nutrition. In our interventions, we use innovative methods, which we develop together with the beneficiary communities. This helps us to make sure that our endeavours are successful from the perspective of the people. Later, throughout project implementation, we develop and apply our own and international standards to make sure that the project results meet the quality we would like to see. Currently, we are working on several continents with programs in Latin America and the Caribbean, Asia, Eastern Europe, the Middle East, and Africa, where we plan to increase our engagement over the coming years. For each continent, we have clear geographic focus areas in order to strategically concentrate our efforts. In all these countries, we work with our partners to make them excel in what they do and become relevant players in the field of humanitarian assistance and development. But we also team up with the Swiss and international organisations to strengthen our voice and contribute to the ongoing dialogue on global development policies. As a Swiss organisation, we want to contribute to the discussion in Switzerland on the consequences of natural and man-made disasters as well as poverty. To do so, we inform the general public about our work and demonstrate how disasters, conflicts, poor health and poverty mutually reinforce each other and hamper development. And we share how the people we work with are exploring new paths to determine their own future.